All right, so now I'm gonna show you what it takes to do a dermal filler service in a client's home. So let's get started. We already got our station here cleaned, disinfected, and laid out for all of our supplies. So let's grab our supplies. Of course, we're gonna need some gauze and some alcohol wipes. We're gonna need our dermal filler. We're gonna need our wound first aid cleansing spray. And honestly, that's pretty much it. I mean, some numbing spray too, because for those again who don't have a high pain tolerance, honestly, for dermal fillers, I do recommend getting the numbing cream, and we're gonna need that. Most of the other supplies that we need are actually in the box of the dermal fillers. So I'm gonna show you what that looks like in a second. So typically the first thing that I do is kind of wipe down the areas that we're gonna be injecting the dermal filler with some alcohol wipes. Then I go in and use the cleansing spray with some gauze and making sure that the area that we're injecting is clean. Then the next thing that I'm going to do is apply the topical numbing cream for 10 minutes. Let that sit on there and really seep into the skin and underneath the skin, the tissues underneath the skin, to make sure that the patient actually is numb. Once they're numb, we're gonna go ahead again and cleanse the area with, and wipe that all off, cleanse the area with the cleansing spray, and get our contents ready while the patient is getting numb. So this is pretty much the container that the dermal fillers come in. It comes with one syringe of 1 ml of dermal filler, and it comes with 2 needles here. So that if you wanted to change out the needle after you've been injecting for a while, your needle starts getting a little dull, you want to change out the needle, it comes with the extra needle as well. For the purposes of this video, I'm not going to open a brand new case to maintain the sterility of this. So I'm going to show you with a syringe that I have already opened, and basically is my demo syringe. It's already been used and there's no dermal filler in it, but this is pretty much what it looks like when you open the box of dermal filler right here. Of course, we would screw on our needle that comes in the kit, screw it on nicely, and you're ready to inject. Okay, so we're gonna lay that here, and as we already cleaned the patient's face, so now we're ready to inject our areas under the skin here. And as we're injecting, we're gonna keep wiping with our cleansing spray, making sure that we're keeping that area clean, so that it doesn't prevent, I mean, it's basically we're keeping it clean to prevent any infections or anything that can happen. But yeah, and then obviously when the patients were finished injecting, we're gonna completely wipe the patient's face off so it's nice and clean, and they get to go about their day.